A 45-year-old female patient presents with a complaint of persistent fatigue and difficulty concentrating for the past 6 months. During your comprehensive history taking, what specific questions should you ask to assess potential underlying causes of her symptoms? Provide a rationale for each question. Answer: in this scenario, it's crucial to use a targeted approach to uncover potential causes of the patient's symptoms. Here are specific questions to consider. Can you describe your sleep patterns over the past few months? Rationale: poor sleep quality can lead to fatigue and cognitive issues. Understanding sleep duration and disturbances can highlight potential sleep disorders like insomnia or sleep apnea. Have you experienced any significant life stressors or changes recently? Rationale: psychological factors such as stress, anxiety, or depression can manifest as fatigue. Identifying psychosocial stressors helps in understanding the context of her symptoms. What is your diet like, and have you noticed any changes in your appetite? Rationale: nutritional deficiencies, particularly in iron or vitamin B, could contribute to fatigue. Changes in appetite could also signal underlying depression or anxiety. Have you had any recent illnesses or chronic health issues? Rationale: chronic diseases, infections, or even recent illnesses can lead to ongoing fatigue. Identifying these can direct further evaluation and management. Are you currently taking any medications, and have you had any recent changes in your medication regimen? Rationale: side effects from medications can include fatigue. Understanding her pharmacological history is essential for evaluating potential drug-related issues. A 60-year-old male patient presents to the clinic with worsening shortness of breath and a chronic cough. After focused physical examination, you note bilateral crackles in the lung bases. What differential diagnoses should be considered, and how would you prioritize them based on the clinical findings? Answer: given the patient's age, symptoms, and examination findings, the following differential diagnoses should be considered. Heart failure. The presence of crackles suggests pulmonary congestion, often seen in heart failure. History of hypertension or coronary artery disease would elevate this diagnosis. Pneumonia. An acute exacerbation of chronic cough with shortness of breath could suggest an infectious process. Fever, chills, and pleuritic pain would further support this diagnosis. Chronic obstructive pulmonary disease (COPD). A history of smoking or exposure to environmental toxins combined with chronic cough and dyspnea would suggest COPD, particularly if wheezing is present. Interstitial lung disease. Conditions like pulmonary fibrosis could present with crackles. Occupational history or exposure to certain drugs could help prioritize this diagnosis. Pulmonary embolism. While crackles are not typically associated with PE, the acute onset of dyspnea warrants consideration of this diagnosis, particularly if there are risk factors like recent surgery or immobility. ECA healthcare setting. Describe a quality improvement initiative you could implement to enhance patient safety in medication administration. What specific methodologies would you employ, and how would you measure success? Answer: one potential quality improvement initiative could be the implementation of a medication reconciliation program. This program aims to prevent medication errors during transitions of care. Methodologies to employ include standardized protocols. Develop standardized processes for reconciling medications at admission, transfer, and discharge. This includes verifying the patient's current medications with the new orders. Interdisciplinary teams. Form a team that includes pharmacists, nurses, and physicians to facilitate communication and ensure thorough review of medications. Education and training. Provide regular training sessions for staff on the importance of medication reconciliation and best practices. Use of technology. Implement electronic health record (EHR) systems that prompt providers to conduct medication reconciliation during patient encounters. Patient involvement. Encourage patients to maintain an updated list of their medications and involve them in discussions regarding their treatment. Measuring success. Success could be measured through metrics such as reduction in adverse drug events, ADES, track incidence of medication errors pre and post-implementation, increase compliance rates. Assess the percentage of reconciliations completed during transitions of care. Patient satisfaction surveys. Evaluate patient understanding of their medication regimens and their confidence in medication safety. Mr. Thompson is a 52-year-old man with a history of type 2 diabetes and hypertension. He presents with severe abdominal pain that started suddenly. On examination, his abdomen is distended and tender with guarding. What should be your next steps in management, and what are the potential diagnoses you need to rule out? Answer: in this scenario, Mr. Thompson's symptoms and physical findings suggest an acute abdominal process. The next steps in management should include immediate assessment. Obtain vital signs to assess hemodynamic stability. Check for signs of shock or infection such as fever or tachycardia. Laboratory tests. Order complete blood count, CBC, metabolic panel, and liver function tests, LFTS. These can help identify signs of infection, organ failure, or metabolic disturbances. Imaging studies. An abdominal ultrasound or computed tomography (CT) scan should be performed to evaluate for acute appendicitis, given the sudden onset of pain, cholecystitis, particularly if pain is in the right upper quadrant, pancreatitis, common in patients with diabetes characterized by epigastric pain, bowel obstruction or perforation. Look for signs of free air or fluid. Surgical consultation. If findings suggest a surgical abdomen e.g., appendicitis or perforated viscus, consult surgery promptly. Discuss the importance of cultural competence in patient care. How can healthcare providers enhance their cultural awareness to improve patient outcomes? Answer: cultural competence is critical in delivering effective patient care as it encompasses understanding and respecting diverse cultural backgrounds. Its importance includes improved communication. Culturally competent providers can better communicate with patients, reducing misunderstandings and enhancing adherence to treatment plans. Tailored interventions. Understanding a patient's cultural beliefs can inform tailored health interventions that align with their values and practices, leading to better outcomes. Reduced health disparities. Culturally competent care can help address and reduce health disparities among minority populations, promoting equity in healthcare. Strategies to enhance cultural awareness. Training programs. Implement regular training sessions focused on cultural competence and awareness of implicit biases. Community engagement. Foster relationships with local cultural organizations to better understand community needs and health concerns. Self-reflection. Encourage providers to engage in self-reflection regarding their biases and assumptions and to seek feedback from peers and patients. Language services. Utilize interpreters and translated materials to ensure effective communication with non-English speaking patients. When evaluating a patient presenting with joint pain, what key components should be included in the history and physical examination to differentiate between inflammatory and non-inflammatory arthritis? Provide a rationale for each component. Answer: differentiating between inflammatory and non-inflammatory arthritis requires a detailed history and physical examination, including the following key components. Onset and duration of symptoms. Inflammatory arthritis often has a more acute onset, while non-inflammatory conditions may develop gradually. Joint characteristics. Inflammatory arthritis typically presents with swollen, warm, and tender joints, whereas non-inflammatory arthritis may show less warmth and swelling. Systemic symptoms. Symptoms such as fever, fatigue, or weight loss may suggest an inflammatory process, commonly seen in conditions like rheumatoid arthritis or lupus. Morning stiffness duration. Inflammatory arthritis often results in prolonged morning stiffness lasting more than 30 minutes, while non-inflammatory arthritis may cause brief stiffness. Family and medical history. A family history of autoimmune diseases or inflammatory conditions can indicate a predisposition to inflammatory arthritis. Physical examination findings. Perform a thorough examination to identify signs of inflammation, including joint swelling, range of motion limitations, and signs of systemic involvement, e.g., skin rashes. A 70-year-old female with a history of osteoporosis presents after a fall and is found to have a hip fracture. What factors should be considered in her management plan, and what are the potential complications associated with her condition? Answer: in managing a 70-year-old female with a hip fracture, several factors must be considered. Surgical intervention. Early surgical intervention is often indicated for hip fractures to reduce complications related to mobility. Factors such as her overall health, comorbidities, and the type of fracture will influence surgical decisions. Preoperative optimization. Assess cardiac and pulmonary function to minimize perioperative risks. Optimize her medications, especially anticoagulants if she is taking them. Pain management. Effective pain control is essential for comfort and rehabilitation. Consider multimodal analgesia strategies. Rehabilitation needs. Postoperative rehabilitation plays a crucial role in recovery. Develop a comprehensive plan that includes physical therapy to regain mobility. Potential complications. Deep vein thrombus, DVT. Immobility increases the risk of thromboembolic events. Pulmonary complications. Patients may develop pneumonia or atelectasis due to decreased mobility. Pressure ulcers. Prolonged bed rest can lead to skin integrity issues. Delayed union or non-union. Poor bone healing due to osteoporosis can complicate recovery. Describe the role of the healthcare failure mode and effects analysis it SHEMI in improving patient safety. How can this tool be implemented effectively within a healthcare organization? Answer: HFME is a proactive approach used to identify potential failure modes within a healthcare system and assess their impact on patient safety. Its role includes systematic identification of risks. HFME helps teams systematically identify and evaluate processes where failures may occur, enabling the organization to address risks before they impact patient safety. Prioritization of interventions. By assessing the severity and likelihood of failures, HFME allows organizations to prioritize interventions based on potential risk to patient safety. Multidisciplinary collaboration. Implementing HFME promotes collaboration among various healthcare professionals, enhancing the understanding of how different roles impact patient safety. Effective implementation steps. Training staff. Conduct training sessions to familiarize staff with HFME concepts and methodologies. Establishing a multidisciplinary team. Create a diverse team that includes representatives from various disciplines to ensure comprehensive evaluations. Identifying high-risk processes. Focus on high-risk areas, such as medication administration or surgical procedures, to begin the analysis. Documenting findings. Record identified failure modes and recommended actions, ensuring transparency and accountability in the process. Monitoring and revising processes. Continuously monitor the effectiveness of implemented changes and revise processes as necessary based on ongoing evaluations. In assessing a patient with suspected congestive heart failure, what key historical factors and physical examination findings would aid in confirming the diagnosis? Explain the relevance of each component. Answer: to assess a patient with suspected congestive heart failure, CHF, the following historical factors and physical examination findings are critical. History of cardiac disease. A previous history of conditions like hypertension, myocardial infarction, or arrhythmias increases the likelihood of CHF. Symptom inquiry. Patients may report dyspnea on exertion, orthopnea, paroxysmal nocturnal dyspnea, or edema, which are classic symptoms of CHF. Medication history. Understanding the patient's current medications can highlight compliance issues or potential side effects that might exacerbate CHF. Social history. Lifestyle factors such as smoking, alcohol use, and physical activity levels can impact heart function and contribute to symptoms. Physical examination findings. Vital signs. Elevated blood pressure, tachycardia, or irregular rhythms can indicate hemodynamic instability associated with CHF. Auscultation of lung sounds. The presence of crackles or wheezes suggests pulmonary congestion, a hallmark of heart failure. JVD. Jugular venous distension. Elevated JVD indicates increased central venous pressure, commonly seen in CHF. Peripheral edema. Assessing for pitting edema in the lower extremities provides insight into fluid retention associated with heart failure. Hepatomegaly. A palpably enlarged liver can indicate right-sided heart failure and congestion. Mrs. Patel, a 35-year-old woman with a history of asthma, presents to the emergency department with worsening shortness of breath and wheezing after exposure to a known allergen. What should be your immediate management steps, and how can you assess a response to treatment? Answer: in managing Mrs. Patel's acute asthma exacerbation, immediate steps should include oxygen supplementation. Rationale: assess her oxygen saturation using pulse oximetry. If it is below 92%, supplemental oxygen should be provided. Bronchodilator therapy. Rationale: administer short-acting beta-agonist, SABA, like albuterol via nebulizer or metered-dose inhaler. This medication will help relax bronchial smooth muscle and alleviate wheezing and shortness of breath. Systemic corticosteroids. Rationale: if the exacerbation is moderate to severe, administering oral or intravenous corticosteroids, e.g. prednisone, will reduce airway inflammation. Monitoring vital signs. Rationale: regularly monitor her vital signs and respiratory status, including respiratory rate, heart rate, and peak expiratory flow rate (PEFA), to assess the severity of her condition. Assessing response to treatment. Symptom improvement. Monitor for reduction in wheezing and shortness of breath after bronchodilator therapy. Peak expiratory flow rate (PEFA). Measure PE, FR before and after treatment to quantify improvement in lung function. A significant increase indicates effective bronchodilation. Oxygen saturation. Repeat pulse oximetry to ensure oxygen saturation levels are improving and above 92%. ACA cohort study assessing the impact of a specific dietary intervention on cardiovascular disease risk. Researchers followed two groups of participants over 10 years. One group adopted the intervention while the other maintained their usual diet. After 10 years, the incidence of cardiovascular disease was compared between the two groups. What type of study design is this, and what are the strengths and weaknesses of this approach? Answer: this study is classified as a cohort study, a type of observational study design where participants are followed over time to see how exposures affect outcomes. Strengths: temporal relationship. Cohort studies establish a clear timeline of exposure and outcome, allowing for better inference of causality. Multiple outcomes. Researchers can investigate multiple outcomes related to the exposure. Weaknesses: bias. Selection bias may occur if participants self-select into the study groups based on dietary habits. Time and cost. These studies often require long follow-up periods and substantial resources, which can limit feasibility. Understanding cohort studies is crucial as they are widely used in epidemiological research to inform public health policy and interventions. Explain the role of health education in community health initiatives and describe at least 3 effective strategies for promoting health in a community setting. Answer: health education is integral to community health initiatives as it empowers individuals with knowledge about health risks and promotes behaviors that prevent disease. Effective strategies, workshops, and seminars. These can be organized to educate the community on specific health topics such as nutrition, exercise, and disease prevention, enhancing awareness and encouraging healthier lifestyles. Health fairs. Community health fairs provide free screenings and information about various health services, encouraging participation and engagement with health resources. Social media campaigns. Utilizing social media platforms can reach a broader audience, effectively disseminating health information and encouraging community discussions around health topics. These strategies foster community engagement and can lead to sustainable health improvements by addressing social determinants of health. Discuss the principle of autonomy in medical ethics, particularly in the context of informed consent. How should healthcare providers navigate situations where a patient's decision appears to conflict with recommended medical interventions? Answer: the principle of autonomy holds that patients have the right to make informed decisions about their medical care. Informed consent is a process where healthcare providers ensure patients understand their diagnosis, treatment options, risks, and benefits before consenting to any medical intervention. Healthcare providers should navigate conflicts by respecting the patient's choice, even if the decision seems unwise. The patient's autonomy must be respected. Providing comprehensive information. Providers should ensure that the patient fully understands the implications of their decision and the potential consequences of refusing treatment. Engaging in shared decision-making. This approach fosters a collaborative environment where healthcare providers and patients discuss the best course of action, considering the patient's values and preferences. Ultimately, the goal is to balance respect for autonomy with the ethical obligation to provide beneficial care. Analyze the impact of healthcare policy on public health outcomes, particularly focusing on the Affordable Care Act. What specific provisions of the ACA have contributed to improved access to healthcare services? Answer: healthcare policy significantly influences public health outcomes by shaping access to and quality of care. The Affordable Care Act introduced several key provisions that enhanced healthcare access. Medicaid expansion. The ACA allowed states to expand Medicaid eligibility, providing insurance to millions of low-income individuals and families who previously lacked coverage. Health insurance marketplaces. It created marketplaces where individuals can purchase insurance with subsidies, increasing affordability and accessibility of healthcare services. Preventive services mandate. The ACA requires that certain preventive services, such as vaccinations and screenings, be provided without cost sharing, promoting early detection and preventive care. These provisions have collectively improved access to care, reduced healthcare disparities, and positively impacted overall public health. Dr. Williams is treating MS. Thompson, a 65-year-old patient with terminal cancer, MS. Thompson expresses a desire to pursue aggressive treatment despite the low probability of success, citing her wish to fight the disease. Dr. Williams believes that palliative care would be more appropriate and wishes to discuss this with her. What ethical principles should Dr. Williams consider in addressing MS? Thompson's request, and how should he approach the conversation? Answer: Dr. Williams should consider the following ethical principles. Autonomy. MS. Thompson has the right to make decisions regarding her treatment. Dr. Williams must respect her wishes even if he disagrees. Beneficence. He should act in the patient's best interest, which involves providing treatments that enhance her quality of life, even if they may not prolong it. Non-maleficence. Dr. Williams should consider whether the aggressive treatment may cause more harm than good, potentially leading to unnecessary suffering. approach, open dialogue. Dr. Williams should initiate a candid conversation with Ms. Thompson, discussing the realistic outcomes of aggressive treatment versus palliative care, educating the patient, providing information on the benefits and limitations of both approaches, encouraging her to consider quality of life as a critical factor. Shared decision-making, involving Ms. Thompson in the decision process, respects her autonomy while ensuring she has all the necessary information to make an informed choice. What are the primary components of a successful community health initiative aimed at preventing infectious diseases? Discuss how these components interact to create an effective program. Answer: a successful community health initiative for preventing infectious diseases should include surveillance. Continuous monitoring of disease incidence and prevalence helps identify outbreaks and target interventions effectively. Vaccination programs. Increasing immunization rates through outreach and education reduces the incidence of vaccine-preventable diseases. Health education. Educating the community on hygiene practices and the importance of vaccinations empowers individuals to take preventive actions. Access to healthcare services. Ensuring that the community has access to healthcare resources facilitates timely treatment and prevention. These components interact synergistically. Effective surveillance informs vaccination strategies, while education increases community engagement and healthcare access, ultimately leading to reduced disease transmission. Describe the ethical considerations involved in conducting clinical research involving human subjects. What are the key elements that must be addressed to ensure ethical standards are upheld? Answer: ethical considerations in clinical research include informed consent. Participants must be fully informed about the study's purpose, procedures, risks, and benefits, and must voluntarily agree to participate without coercion. Beneficence. Researchers must ensure that the study design minimizes risks and maximizes potential benefits to participants. Justice. The selection of participants should be fair, ensuring that vulnerable populations are not exploited and that the benefits and burdens of research are equitably distributed. Confidentiality. Protecting participants' privacy and handling personal data securely is essential to maintaining trust and ethical integrity in research. Adhering to these ethical principles is critical in safeguarding participants' rights and well-being while contributing to scientific knowledge. How does behavioral epidemiology differ from traditional epidemiology, and what role does it play in understanding public health issues? Answer: behavioral epidemiology focuses on the impact of behavioral factors, e.g., smoking, diet, physical activity, on health outcomes, while traditional epidemiology examines the distribution and determinants of diseases within populations. Role in public health. Understanding risk factors. Behavioral epidemiology helps identify how specific behaviors contribute to disease incidence, enabling targeted interventions. Guiding policy. Insights from behavioral studies inform public health policies aimed at promoting healthy behaviors and reducing risky ones. Evaluating interventions. This field assesses the effectiveness of health promotion strategies, helping to refine and improve public health initiatives. By examining the behavioral aspects of health, behavioral epidemiology provides a comprehensive understanding of public health issues and informs strategies to improve population health. Discuss the importance of maintaining professional boundaries in the physician-patient relationship. What are the potential consequences of boundary violations, and how can healthcare providers ensure they uphold professional integrity? Answer: maintaining professional boundaries in the physician-patient relationship is crucial for fostering trust, ensuring effective communication, and safeguarding patient welfare. Consequences of boundary violations: loss of trust. Patients may feel unsafe or uncomfortable, leading to reluctance to seek care or disclose important health information. Legal repercussions: violating boundaries can lead to lawsuits or disciplinary action by medical boards. Emotional harm: patients may experience emotional distress or trauma from inappropriate interactions. Ensuring professional integrity. Clear communication. Establishing clear expectations regarding the professional relationship can help prevent misunderstandings. Self-reflection. Healthcare providers should regularly assess their interactions with patients to ensure that personal feelings do not compromise professionalism. Continuing education. Engaging in training on ethics and professional boundaries can enhance providers' awareness and adherence to ethical standards. Explain the concept of health equity and the role of advocacy in achieving it. What are the primary barriers to health equity, and how can healthcare professionals address these challenges? Answer: health equity refers to the principle of fairness in health, ensuring that all individuals have the opportunity to attain their highest level of health regardless of social, economic, or environmental factors. Role of advocacy. Raising awareness. Advocates can highlight health disparities and their underlying causes, mobilizing community support for equitable policies. Policy change. Healthcare professionals can lobby for policies that address systemic barriers such as poverty and lack of access to healthcare. Community engagement. Engaging communities in health initiatives fosters ownership and encourages grassroots movements aimed at promoting health equity. Barriers to health equity. Socioeconomic factors. Economic disparities lead to unequal access to healthcare resources. Cultural competence. Lack of understanding and respect for diverse cultural beliefs can hinder effective communication and care. Policy barriers. Legislation may inadvertently perpetuate health disparities by limiting access to care for certain populations. Healthcare professionals can address these challenges by advocating for inclusive policies, enhancing cultural competence, and engaging with underserved communities to foster equitable health outcomes. Describe the role of interdisciplinary teams in enhancing patient care. What are the challenges and benefits associated with their implementation in healthcare systems? Answer: interdisciplinary teams play a crucial role in enhancing patient care by integrating diverse professional expertise to address complex patient needs holistically. This collaborative approach allows healthcare providers such as physicians, nurses, social workers, and pharmacists to share insights, leading to improved patient outcomes, enhanced communication, and a more coordinated care plan. Benefits: comprehensive care. Patients receive a more comprehensive approach to treatment as team members contribute their unique perspectives, leading to better assessment and management of conditions. Enhanced communication. Interdisciplinary collaboration fosters open communication, reducing the likelihood of errors and improving information sharing among healthcare professionals. Patient-centered care. The involvement of various specialists enables the development of tailored treatment plans that respect patients' preferences and needs. Challenges. Role confusion. Team members may experience uncertainty regarding their roles, leading to conflicts or overlapping responsibilities. Communication barriers. Differences in terminology, professional culture, or communication styles can hinder effective collaboration. Time constraints. Coordinating schedules for team meetings can be challenging, especially in busy clinical environments. Relevant guidelines. The Joint Commission emphasizes the importance of effective teamwork in its standards for patient safety, advocating for structured communication tools like SBAR, situation, background, assessment, recommendation, to facilitate this process. Explain how understanding healthcare economics can influence resource allocation in healthcare delivery systems. What principles guide cost-effective care? Answer: understanding healthcare economics is vital for effective resource allocation in healthcare delivery systems, as it provides insight into how resources are limited and how they can be utilized most efficiently. Economic principles such as supply and demand, opportunity cost, and marginal utility can inform decisions about where to allocate funds, personnel, and technology. Key principles of cost-effective care. Opportunity cost. When resources are allocated to one service, the benefits of alternative uses must be considered. For example, investing in preventive care may reduce the need for more expensive acute care services. Cost-benefit analysis. Evaluating the costs versus the benefits of a healthcare intervention can guide decisions on which treatments provide the best value for money. Efficiency. Care processes should be designed to maximize outcomes while minimizing costs, focusing on reducing waste and improving service delivery. Regulatory guidelines. The Affordable Care Act includes provisions that encourage cost-effective care through value-based payment models, rewarding providers for quality and efficiency rather than volume. Discuss the importance of self-assessment and reflection in the continuous professional development of healthcare practitioners. How can these practices improve patient outcomes? Answer: self-assessment and reflection are critical components of continuous professional development in healthcare. They enable practitioners to evaluate their knowledge, skills, and attitudes, fostering lifelong learning and enhancing the quality of care provided. Importance: identifying gaps. Self-assessment allows healthcare providers to identify areas for improvement, ensuring they remain competent in their field. Promoting accountability. Reflecting on one's practice promotes accountability, encouraging practitioners to take responsibility for their actions and decisions. Enhancing patient care. By continuously updating their knowledge and skills, healthcare practitioners can apply the latest evidence-based practices, leading to improved patient outcomes. Implementation strategies. Practitioners can utilize tools such as clinical audits, peer feedback, and patient satisfaction surveys to facilitate self-assessment. The American Osteopathic Association (AO) recommends incorporating reflective practice into professional development plans to ensure continuous growth. Mr. Smith is a 45-year-old patient with multiple chronic conditions who frequently visits the hospital. His care team consists of a primary care physician, a nurse, a dietitian, and a social worker. Despite the interdisciplinary approach, Mr. Smith's health continues to decline. As a new member of the team, how should you assess the situation and what strategies could you propose to improve his care? Answer: to assess the situation effectively, a comprehensive evaluation of Mr. Smith's care plan should be conducted, focusing on the following aspects. Team communication: evaluate how effectively team members are communicating about Mr. Smith's condition. Are there regular meetings to discuss his progress? Care coordination: analyze the coordination of care among team members. Are there clear roles and responsibilities assigned to each team member regarding his treatment? Patient engagement: assess how engaged Mr. Smith is in his own care. Is he receiving adequate education about his conditions and treatment options? Proposed strategies: regular team meetings. Implement weekly interdisciplinary meetings to review Mr. Smith's progress, ensuring that all team members are aligned and can address any concerns. Patient-centered approach: enhance Mr. Smith's engagement by involving him in decision-making and tailoring the care plan to address his personal goals and preferences. Enhanced education: provide Mr. Smith with education about his conditions and self-management strategies, leveraging the expertise of the dietitian and social worker. What are the key principles of conducting clinical research and how do they ensure the integrity of research findings? Answer: the integrity of clinical research findings relies on several key principles. Ethical considerations: research must be conducted with respect for participants' rights, ensuring informed consent, confidentiality, and the right to withdraw without penalty. Scientific rigor: research designs should be robust, employing appropriate methodologies such as randomized controlled trials (RETS) to minimize bias and confounding variables. Statistical validity: proper statistical analysis is crucial for interpreting data accurately, including considerations of sample size and power to detect meaningful differences. Guidelines: the Declaration of Helsinki provides ethical principles for medical research involving human subjects, emphasizing the need for ethical review boards and transparent reporting of findings. Analyze how socioeconomic factors influence patient access to healthcare services. What strategies can be implemented to mitigate these barriers? Answer: socioeconomic factors significantly influence patient access to healthcare services. Individuals from low socioeconomic backgrounds often face barriers such as financial constraints, lack of transportation, and limited health literacy, which can hinder their ability to seek timely and appropriate care. Barriers: financial constraints. High out-of-pocket costs can deter individuals from seeking necessary care or adhering to treatment plans. Transportation issues. Lack of reliable transportation can make accessing healthcare facilities challenging, particularly for those in rural areas. Health literacy. Individuals with limited health literacy may struggle to understand health information, making it difficult to navigate the healthcare system. Mitigation strategies. Community health programs. Establishing mobile clinics or telehealth services can improve access for underserved populations. Financial assistance programs. Offering sliding scale fees or assistance programs can alleviate financial burdens for low-income patients. Health education initiatives. Implementing community education programs can improve health literacy and empower individuals to make informed decisions about their health. Relevant regulations. The Social Security Act includes provisions aimed at improving access to care for low-income individuals through Medicaid and Medicare programs. Evaluate the significance of appraising and applying research findings in clinical practice. How does this process contribute to evidence-based medicine? Answer: appraising and applying research findings is fundamental to evidence-based medicine as it ensures that clinical decisions are informed by the best available evidence. This process involves critical evaluation of the literature to assess the validity, relevance, and applicability of research findings to specific clinical situations. Significance: improved patient outcomes. BM leads to better patient outcomes by incorporating proven interventions into practice, minimizing the use of ineffective treatments. Reduction of variability in care. Applying standardized evidence reduces variability in clinical practice, promoting consistency in treatment approaches. Enhanced professional development. Engaging in this process fosters a culture of inquiry and continuous learning among healthcare professionals. Guidelines for implementation. The evidence-based practice model encourages practitioners to formulate clinical questions, search for relevant literature, appraise evidence, and apply findings in practice while evaluating the outcomes. What are the ethical considerations in conducting clinical trials, and how do they protect participants? Answer: ethical considerations in clinical trials are paramount to protecting participants and ensuring the integrity of the research process. Key ethical principles include informed consent. Participants must be fully informed about the nature of the study, potential risks and benefits, and their right to withdraw at any time without penalty. Risk-benefit assessment. Researchers must ensure that the potential benefits of the research outweigh the risks to participants, adhering to the principle of beneficence. Confidentiality. Researchers must protect participants' privacy and confidentiality by anonymizing data and securely storing sensitive information. Regulatory oversight. Institutional review boards (ERBs) are responsible for reviewing research proposals to ensure compliance with ethical standards as mandated by the U.S. Department of Health and Human Service (HHS) regulations. Dr. Martinez, a primary care physician, notices that her patient population has a high rate of uncontrolled hypertension. After reviewing the literature, she finds that community engagement strategies have been effective in similar populations. What steps should Dr. Martinez take to develop a community intervention program aimed at reducing hypertension, and what metrics should she use to evaluate its effectiveness? Answer: to develop a community intervention program aimed at reducing hypertension, Dr. Martinez should take the following steps. Needs assessment. Conduct a thorough assessment of the community to identify specific barriers to hypertension management, including socioeconomic factors and healthcare access. Engagement with stakeholders. Collaborate with local health departments, community organizations, and patient advocacy groups to gather support and resources for the initiative. Program design. Develop a comprehensive program that may include educational workshops on lifestyle modifications, regular blood pressure screenings, and partnerships with local gyms for exercise programs. Implementation. Roll out the program, ensuring community members are aware of the resources available to them. Metrics for evaluation. Blood pressure readings. Track the average blood pressure of participants before and after the intervention to assess clinical outcomes. Participation rates. Measure the number of individuals who engage in the program and complete follow-up assessments. Patient satisfaction surveys. Collect feedback from participants to evaluate the perceived value and impact of the program. Guidance from practice. The CDC recommends community-based approaches for managing chronic diseases, emphasizing the importance of tailored interventions that consider the unique characteristics of the target population. Discuss the impact of technology on healthcare delivery systems. What are the potential advantages and disadvantages of implementing electronic health records (AES)? Answer: the implementation of technology, particularly electronic health records (AES), has significantly transformed healthcare delivery systems. Advantages: improved accessibility. HRS provide healthcare providers with quick access to patient information, facilitating better informed clinical decisions and reducing redundancy in testing. Enhanced coordination of care. HRS support better communication among interdisciplinary teams, improving care coordination and reducing the risk of errors. Data analytics. The use of HRS allows for the collection and analysis of large data sets, enabling healthcare organizations to identify trends, improve quality of care, and conduct research. Disadvantages. Cost of implementation. The initial investment and ongoing maintenance costs of HR systems can be substantial, particularly for smaller practices. Training requirements. Staff must undergo training to effectively use HR systems, which can lead to temporary productivity losses.